Good afternoon, viewers. It is nice to be sharing with you today on the subject of World Cancer Day 2022. My name is Gerald Miller. I am the Parish Health Promotion and Education Officer, and I am based at the Westmoreland Health Department. Next. Today we are observing World Cancer Day, and it is important that we have this discussion because cancer is a global problem, and we too in Jamaica, as well as Westmoreland, have been experiencing our own challenges with cancer. Cancer is the second leading cause of death worldwide, and together we can change this. This year, the theme for World Cancer Day is Close the Care Gap. It's about raising awareness of this equity gap that affects almost everyone in high as well as low and middle income countries, and it's costing lives. So the issue of inequity, there is so much inequality in the whole issue of accessing care for persons who are living with cancer. Some of the factors that give rise to this inequity include income, education, your geographical location, where you live, your ethnic background, gender, your age, disability, and lifestyle. So these are some of the issues that can impact on the accessing of cancer care. And so we are using World Cancer Day as a means of building awareness and to advocate for more equity in the accessing of cancer services. Next. Did you know that 10 million people each year die from cancer? 70% of cancer deaths occur in low to middle income countries, and Jamaica would be categorized as a low to middle income country. Less than 30% of low-income countries have cancer treatment services available, compared to 90% in high-income countries. So you can see the challenges for countries that do not have the resources, just like Jamaica. And so we have to use this day to build some awareness and to advocate for more equitable service in the support for cancer. Next. Westmoreland, we need to zero in on what goes on in Westmoreland as it relates to cancer. And as you might know, Westmoreland too has its challenges with cancer. Next. The last statistics that we have gotten, which was generated by the Registrar General Department, indicated that 23% of all adult cancer deaths take place in Westmoreland. So Westmoreland too has challenges as it relates to cancers. And as you would have seen, looking at the graph, we would have observed that breast cancer is one of the cancers that are very common in Jamaica, in Westmoreland, followed by we have malignant neoplasm, the cancer of the trachea, the bronchus, and lungs. So you see that is also creeping up in Westmoreland. So it's important for us on World Cancer Day for us to be aware of the risk factors, which we will discuss later on in other slides. Next. We also see here the issue of cancers, which is the leading cancer deaths in Jamaica by parish, and you see with female accounting for 19% of all the adults' death. And here you will see for females, breast cancer, you would see here as a very common cancer among our female population. Is the leading cause of deaths. If you look at the graph, you'll see that breast cancer is very common in Westmoreland. So it's important for us to understand the issue of what is going on with cancer and for us to build the awareness and for us to screen for breast cancer. Women can screen for it. Mammograms are available. Once you're 40 and above, then it's always good for you to start to have your yearly mammogram. And for doing your breast self-examination, which is recommended that women do so as to prevent the cancer from spreading or from becoming very becoming aggressive. So it's been important for us to do our breast self-examination. Men can do that because men too can have breast cancer, but for females, the breast self-examination is important to detect lumps that can be cancerous and needs to be dealt with. Next. Did you know that white women in the US have the 5-year survival rate for cervical cancer is 71%, and for black women, look at it, the rate is just 58%. Cancer kills nearly 10 million people a year, and some 70% of those are age 65 or older, yet older population face disproportionate barriers to effective treatment. Up to 3.7 million lives could be saved each year through resource-appropriate strategies for prevention, early detection, and timely and quality treatment. In Jamaica, we know cervical cancer is very common among our women, and we want our women to take this business of screening. You can screen for cervical cancer. A pap smear is recommended that you do on a yearly basis, and we encourage our women to get screened, do their pap smear on a yearly basis. So if there are any abnormal cells, anything happening within the cervix that is not normal, then the pap test can detect such abnormality, and the treatment option can be pursued so as to prevent any serious spreading of whatever is happening there, whether it is cancerous or not. The procedures can help in staving off any possible infection that can happen. Next slide. Let us look at some of the key issues here in dealing with the barriers. Some of the barriers to cancer care include minority population in developed countries. There are some persons who are discriminated against because of their ethnic background. So you have that socioeconomic status, like in Jamaica. If you don't have the resources, cancer treatment is very expensive. So it's important for us to understand that we have to have resources, and the socioeconomic status can be a main barrier, because if you don't have the resources, then you are not going to be able to provide, to access the treatment options that are available. Rural-urban divide. In the rural parts, you would have less access to services for cancer treatment and cancer care. And age, if you are older, then you might not be given the kind of attention that is required because of your age. And homophobia in Jamaica, with our men apparently who should be screened for prostate cancer, they tend to have a fear for a doctor performing a digital rectal examination on them because of the procedure, which involves the doctor inserting the index finger in the anus, and they tend to see that as not masculine. Yes, so top 5 cancer deaths in Westmoreland, and we want you to look at them: stomach, colon, rectum, and anus, cancer of the trachea, the bronchus and lungs, and breast, cervical cancer, and prostate. So we do in Westmoreland, that is between 2004 and 2018. So we see here cancer is a big problem too in Westmoreland. So just as we had mentioned that it's a global problem, and looking at it from a local perspective, we do have common cancers which are impacting other countries. You know, I'm sure we are not unique with what is happening here in Westmoreland as it relates to cancers, because other parishes too also have issues pertaining to cancer. So we just want you to get screened for the cancers that you can screen for. So you can screen for your colon cancer, you can screen for your breast cancer, for cervical cancer, for prostate cancer, you can screen for it. So during the observance of World Cancer Day, we want you to get the information and process it and access whatever screening services that are available. The care gap, how do we close the care gap? What do we mean by inequity? All right. In healthcare, inequity refers to uneven distribution of resources. By contrast, inequity means unjust, avoidable differences in care or outcomes. So when the resources are not distributed evenly, we refer to that as being as inequity, as not being equal. The difference may seem subtle, but closing the cancer care gap isn't about simply providing everyone with equal resources. One size doesn't fit all, and every challenge demands a different solution. Equity is about giving everyone what they need to bring them to the same level. And that is what World Cancer Day is focusing on, building awareness about the inequity that exists, not just in Jamaica, but worldwide as it relates to cancer care. Next. So I want to thank you for sharing, for participating in this channel by sharing. We are grateful for your support in watching the channel, and for you to use the information that is shared here in protecting yourself and to screen. We are insisting that you screen for cancer, and if you have the resources and can access screening opportunities that exist within the parish, then we would want you to do that. I want to say thanks again to Nola Steer for her support. She has been a tower of strength in getting this channel up, and I do appreciate this kind of partnership with her in providing the technical guidance and getting this thing up and running. And to Dr. Skyers from the Ministry of Health and Wellness, Dr. Nicola Skyers, who is the national, she is the director of NCDs, non-communicable diseases and injury prevention in the Ministry of Health and Wellness. Also to Dorothy Satchwell, who also shared her experience with cancer. And we also want to say thanks to thanks to Ms. Satchwell. I've said that for supporting this cause. So thank you very much, and we hope that you will learn from this production.